Good evening.
Uy, ¿dónde me siento? Acá. Es que está todavía a la disposición del esquema previo. Nos acompaña la compañera. Por favor. Muy buenas noches.
Good evening,
Por estar
everyone.
presente.
How are you?
Hoy son es lunes 4 de mayo, son las
It is
19:01
Monday, May the
horas.
4th.
Estamos
It
en
is
la Ciudad de
7
México, en el
p.m.
Palacio
with
Nacional.
1 minute. We are in the
Vamos a
National
iniciar la
Palace in
conferencia de
Mexico City.
prensa diaria
And let's begin with
sobre
the
la
daily
situación de la pandemia
press
del COVID,
conference
la
regarding the
enfermedad causada por el
situation
nuevo
of
coronavirus
COVID,
SARS-CoV-2.
the disease
Hoy
caused
vamos
by
a
new
tener dos
coronavirus
elementos
SARS-CoV-2.
principales.
Today we'll
El
be
primero es el informe técnico diario que presentará el
presenting
doctor
two
José Luis Alomía, director general de epidemiología.
important subjects,
Y el segundo,
first of
que nos da
which
mucho
is
gusto
the
recibirlo
daily
aquí,
technical report
nos lo
that will be
presentará
presented by
Leslie
Dr.
Costa Miranda,
Alomia.
quien es técnico
And
en
today we
atención y
also have Leslie
orientación
Costa
al
Miranda,
derechohabiente del
who
Instituto Mexicano del Seguro Social.
works at
Leila
IMSS,
Costa ha colaborado con
and she has
distintas unidades médicas del
collaborated with
instituto
different
y su buen
medical units
desempeño
within the
hizo
institute,
que colaborara también
and
en la
because of
apertura
her
del Centro de Canje
outstanding
de Medicamentos
performance,
y
she's
posteriormente
been
participó en la
collaborating
primera
as
clínica
well
de
with
mama
the
que se estableció en el
Drug
país en el
Exchanging
Instituto
Center,
Mexicano del Seguro Social.
and she
Hoy nos va
also
a comentar
helped
precisamente de
build the
esta
first
inquietud que ha habido en los
um,
últimos pocos días
maternity care
sobre el
specialized
tema
unit
de
in Mexico,
comunicación
and
con las y los
today she will
pacientes
be
y
talking
las
to us
familias, que es
about
un
the
aspecto muy importante.
communication
Esta misma mañana
strategy
lo preguntaban y con
between
justa razón
the
sobre
health
qué
professionals
protocolos existen. Pues
and
hoy
the
Leila Costa nos va a
relatives
explicar
of
esto. Muy bienvenida,
those
Leila.
patients that have been hospitalized.
Gracias.
So it will be very
Y
interesting what
posteriormente
she
pasamos
has
a
to say.
preguntas y respuestas
Thank you for
y
being here,
todo lo
and
que ustedes
after
quieran
that we
preguntar
will
será muy
begin
bienvenido.
the Q&A period,
Doctor
and of
Alomía, por
course
favor.
all of your questions are
Claro que sí, con mucho gusto, señor
welcome as
secretario.
always.
Muy buenas
Dr.
noches
Alomia,
para
shall we
todas y para
begin?
todos.
Thank you very
Vamos
much,
a
Deputy
presentar
Secretary.
de
Good
repente
evening, everyone.
el
Let's
panorama,
begin
la
with the
conferencia en la que
international
nos encontramos
landscape.
el día de hoy en el día 43
We
de
are
la
at
Jornada
day
Nacional
43
de
of the
Sana
National
Distancia.
Safe Distance
Nos queda
campaign.
todavía
We
prácticamente
still
todo lo
have
que
60.
resta del mes de mayo para la gran cantidad
We still have
movilización
the well. We've
previsto
we've done
de tener
66
este
press
resguardo
conference
del Programa Nacional
so
de
far,
Sana Distancia.
and we still
Y
have
nos encontramos pues esta
the whole
noche
month
en la
of May
conferencia vespertina número
um,
66. Ya son
to
66 las
complete
conferencias
the
que hemos tenido,
national
con mucho
campaign
gusto
of safe
compartir
distance.
muchas de ellas con todos ustedes. Vamos a la primera diapositiva del
Let's
panorama
begin with the first
internacional,
slide.
en donde vemos cómo sigue siendo solo una tercera
As you
parte
can
de los
see,
casos activos de toda la pandemia en el mundo.
we continue to see that
33% de
only
los
a
casos
third of
confirmados
the
en los
total
últimos
number of
14
cases
días.
worldwide
Y
is
podemos ver
currently
cómo la
active.
región de las
So the active
Américas
pandemic is only
concentra
a third of
más
the
de la mitad,
total
pues
number of
prácticamente
cases.
pasando la mitad, 50.7% del total de todos los casos que se han
Out of
confirmado
these,
en todo el
and
mundo
out of,
en
out
los
of,
últimos 14 días.
out of
Por lo
these
tanto, la
active number of
pandemia se encuentra
cases,
ahora activa y concentrada
50%
en la
are
región de las
happening within
Américas,
the
y vemos
Americas.
también cómo día con día continúa disminuyendo los
And
casos activos en la región de
the
Europa.
number of active cases in the European Union
7.0%, la tasa
and
de
the
letalidad
European
global,
region
también
in
también se
general
fue
continues
incrementando
to
en las
decrease.
últimas semanas,
The
lo cual nos
fatality
permite dar
rate is
seguimiento
at a
de lo que
7%
inició
right now.
la
It
pandemia.
has been showing
En la
some
siguiente diapositiva
gradual
actualizamos las
increase
cifras
for
para
the
el
last
día
few
de hoy en
days.
relación a las
Today's
estadísticas
number
del país.
for
24.905 son los casos
Mexico
confirmados
specifically are
acumulados, es decir,
we
desde que
have
se confirmó el primer caso, siendo una
24,905
tercera parte de ellos, es
cumulative
decir,
confirmed cases, meaning all of the
696,
cases
los
confirmed
casos
since the pandemic
activos, es decir,
started in our
aquellos que
country,
evidenciaron síntomas en
out
los
of
últimos
which
14
only
días y que por lo tanto representan
6,696 are
prácticamente la
active cases,
epidemia
meaning the ones that
activa
have
en
showed
México.
symptoms during the
Se dan
past
143 casos que
14
todavía
days.
mantienen la clasificación de sospechoso.
We
Algunos de
have
ellos se
over
han
13,000
descartado
cases
de
that are
seguro por la prueba de
currently
laboratorio,
cataloged
pero
as
un buen
suspect
porcentaje de ellos también
cases,
será
and
confirmado,
part of
porque
them will
como ya
be
veíamos la semana
discarded
pasada, pues el caso de
after
positividad
testing
se
negative for
encontraba
COVID,
ya
but part
alrededor
of
del
them
.Por ciento. Son
will be put
2.271
into the
defunciones las que
confirmed case
lamentablemente también han
statistic because they
ocurrido
will test
a causa de
positive.
las
Our
complicaciones que
positive result
genera
rate so far is at a
COVID-19.
50%, more or less. We have
61.993 los
unfortunately,
pacientes que
we
han dado
have
negativo a la prueba de SARS-CoV-2
2,271
y el día de
fatalities
hoy
so far
pues
in
estamos
total,
superando más de 100.000 las
and we
personas que han
have
sido
studied over
estudiadas,
a
que han
hundred
sido
thousand
clasificadas como casos
cases so far.
sospechosos y que en un punto de su
So we've had
investigación pues han
a
sido
total
lógicamente
number
catalogadas
of
en los grupos previos a
over
los cuales habíamos
100,000
anteriormente
suspect cases,
mencionado.
that have been later confirmed to be either positive or negative. Here we have the distribution of the cumulative confirmed case number. These 24,905 cases, and how are they distributed per state within the country. Of course, now we have a lot of states that have at least 500 cases or more, and that is why this map appears now mostly in orange. And of course, those states that showed an early intense activity of transmission of the disease are now being represented in dark red, because they have a much higher concentration of cases. Here we have the same numbers represented in the form of a bar graph, and of course we have said several times that those states that have higher populations, larger populations, are of course expected to have a higher number of cases, and that is the case. Now, next slide, we can see specifically the active pandemic within Mexico, meaning those 6,696 cases that have showed symptoms during the past 14 days. And now we can see how we have been looking at a map that was mostly green for the most part, and now there are several states that are appearing in yellow and even in orange. So a lot of states have already surpassed the line of the 100 cases, and some of them have more than 250. And we are talking about the active cases, remember that. So as you can see, the distribution per state shows great variation, and this has to do with a number of factors, one of which is the date in which these states entered the pandemic, because it wasn't at the same time. So we will see some of these states peak first, and then begin to show a significant decrease in the transmission rates, and others will continue to go up. Here we have the same numbers presented in the form of a bar graph, so you can have a better appreciation of the burden of disease per state. Now, here we have the incidence rate of the active pandemic and its distribution per state. And remember, when we talk about incidence rate, we are calculating on the basis of each state population. So we are presenting the number of cases, of active confirmed cases, per 100,000 inhabitants per state. And we can see how some states start to appear in darker shades of green, and there they will most likely be continue to show increase during the upcoming weeks. But then, at some point, after they peak, they will start to show a downward trend. Here we have the same data presented in the form of a bar graph. We're talking about the active pandemic incidence rate per state, remember that? And it varies from all the way from 20, which is the highest, to 1 or 2, which is the lowest. The average is a little bit over 5 cases, confirmed active cases per 100,000 inhabitants nationwide. Here we have the fatality distribution. We continue to observe an upward trend. This tendency has continued for several weeks now, and we see that we continue to have new fatalities every day, and of course, a part of these fatalities are currently suspect fatalities, but they still show the same tendencies. As you remember, the yellow part or the light orange part are those people who have unfortunately died, but they haven't had a positive result for SARS-CoV-2 yet. So when the results of their tests come out, then we will incorporate them into the blue portion or discard them accordingly. This is the same information, but now we present the distribution per state, so we can see which states have a higher proportion of suspect deaths that could potentially bring their numbers up in the following days. Here we have the pandemic curve, as always, presenting the confirmed cases in red and the suspect cases in yellow or light orange. And we are taking as a reference date the date that the symptoms in each patient started. So we continue to see an upward trend, and of course this is the portion of the pandemic curve that continues to go up nationwide. We are currently in phase 3, which is the increase phase, the phase in which this curve continues to go up. And of course, there is an overrepresentation of the suspect cases in those states of the country that are currently peaking with regards to their transmission rates. Here we have the general pandemic curve for the cumulative number of confirmed cases, that is 24,905. We had an increase of 1,434 cases in the last 24 hours, which is a 6.1% increase. And on the bottom, you can see the yellow bars that are the daily daily number of newly confirmed cases. Here we have the IRAG network for hospital surveillance, which remember is the key mechanism that we should be focusing on during phase 3. And basically, we have a network of 674 hospitals that are constantly notifying the bed occupancy rate, the ICU bed occupancy rate, the number of patients that go in, that go out, that are discharged, their status, and a wide array of relevant information. It is important to keep track of the occupancy rates because in order to have an available bed to provide treatment for whoever needs it, we need to have a good system of keeping track of this information, and to the degree that we are able to provide beds for everyone who needs them, we will be able to save more lives. So this is the information from May the 3rd. So, up to 11 p.m. with 59 minutes of May the 3rd, this was the information that was presented by the 634 hospitals that notified, which was 95% of the total number of hospitals. So they notified having 13,387 available beds to provide specific care for respiratory infections. And out of these available beds, 6,222 were currently being occupied or being used. So we're talking about an over 30% occupancy rate. We started, when we started presenting this information more than a week ago, we were at a 20% occupancy rate. Now we're talking about a 30% occupancy rate, and it is, of course, a sign of how this pandemic is developing. As I said, we have a 95% notification percentage or notification rate, meaning that for several days we've had the vast majority of these hospitals updating their information and presenting their notifications in due time. Here we have the distribution for the hospital bed availability per state, or occupancy rate if you want to look at it that way. So it shows great variation across the country, across different states. We have an occupancy rate of 69% for general hospital beds in Mexico City, meaning we only have a 31% of availability, of course. And of course, this is a fluctuating number because every day there are new people who are being discharged, and then they are not using these beds anymore. But we also have every day we have new patients that come into the hospital and need these beds. Other important states in this chart are Baja California with a 63%, Sinaloa, Guadalajara, and the usual suspects. Of course, there are other states that have a very low occupancy rate, and this has to do a lot with the moment in which they entered the pandemic. That was usually later than the other states that show higher occupancy rates. Here we have the occupancy rates specifically for the ICU beds, meaning those beds that are suitable for those patients that are presenting respiratory insufficiency and they need a ventilator. So Mexico City 61% occupancy rate, Sinaloa with 58, Baja California and the state of Mexico are the leading four. And we've seen a gradual increase in the occupancy rates in these four states. And remember, these four states, and comparing them with other maps and with other states, they are the same four states that have the highest incidence rates, the highest burden of diseases, and of course the highest occupancy rates. So all of these data correlates and presents us with a solid basis to keep the population better informed and to make more informed decisions regarding our strategy. That would be my information for today. Thank you. Thank you, Dr. Alomia. And before giving the floor to our colleague on the left, we have prepared a small video in which Yvonne Núñez González, who is the coordinator for social work of the second level of attention of IMSS, will be talking to us about the different communication strategies between health personnel and institute users. IMSS is very aware of the need that the relatives have of knowing the status of their loved ones when they are hospitalized. We're going to have a system for informing them. They are not going to be able to enter the hospital facilities, but we'll provide some external waiting areas so they can rest, so they can sit there, and we will be communicating with them constantly about the status of their relatives. This system has been implementing in each one of the hospitals in the country. So please please rest assured that we are doing everything we can to ensure the health of your loved ones, and we are providing with the highest medical care with all the relevant equipment, and we'll be informing you as soon as they are ready to be discharged and go home and be reunited with you. We want you to be to rest assured and be at peace. Thank you, Yvonne Núñez González. Leila Costa, you have the floor now. Hello.
Mi nombre es Leila Acosta Miranda. Yo estoy en el hospital regional número 1.
I am in the hospital in the
colonia del Valle.
in the hospital number 1 in the neighborhood del Valle. I am a technician in attention to the users of the medical institutions. We are known as TAOC, and we are the link between the medical unit and the user of the health services, and we seek to provide competent services to and to deal with all of the petitions and all of the requests of these users that these users may have. IMSS has created mechanisms for information mechanisms that use the newest technologies that we have access to nowadays. In this way, the relatives of patients that have been hospitalized because of COVID can have quick access to information. We also follow a series of protocols like empathetic treatment protocols, and we also provide training to patients, to relatives regarding measures such as how to correctly wash your hands, how to keep your safe distance, and we explain to them all of the different protocols to ensure their safety and their health. IMSS has created 3 mechanisms through which relatives of those COVID-19 patients can approach us and rely on these protocols. First of all, there is a phone number that the relative can call to, and then in this way they can access. The number is 800 623 2323, and the option is option number 1. If you call this number, you can have quick access to updated information regarding your relative. You can also access this information through email. The email is atender, so ATENDR at ims.gov.mx. ATENDR at ims.gov.mx, as you can see it on the screen, and the phone is also on the screen. Also, we incorporated these waiting areas outside of hospitals that you saw on the video, and in this way the relatives can, in an organized manner, access information in person. But ideally, we ask to all of those relatives of patients that have been hospitalized to stay home and access the information and monitor the status of your loved ones through these remote mechanisms that I have described, through the phone and through email. That would be the ideal scenario. It is very important that we continue to stay at home and to abide by the safe distance national campaign measures. In those cases of where the hospitalized patient is a minor, there is a protocol for a legal guardian or a parent to be able to go and be with them. In this case, we provide this person with personal protective equipment. We instruct them as to how to use it, and we monitor them at all times. I'm just coming from work, I'm wearing my uniform, and we use this uniform. We usually use this blue ornament, but in this moment of contingency we don't use them because they could be a source of infection. So we are only using our white shirt and our
Personas pueden
blue
acercarse con nosotros, pueden
vest.
llamarnos. Nosotros siempre estamos para servirles, siempre
Um,
apegadas al protocolo del buen
We're
trato.
always
Somos esa mano amiga,
available for
esa
you
cara
to
amable
provide
del
information.
instituto.
We are the
Estamos en
kind
las
face of
entradas
IMSS.
de
We are
todos
the
los
human,
hospitales
approachable
de
face of
contingencia,
IMSS.
todos los
We are
hospitales
available at all
COVID-19. Nuestro
hospitals.
módulo está siempre en la
Our
entrada principal.
information
Se
stand or
caracteriza
information
por el
module
color verde
is
con
in
blanco.
the
Estamos
main
siempre
entrance of
para
each
servirles,
hospital,
para
and
ayudar
it
a
is
los
characterized by
usuarios,
the
a la
color
población,
white.
a la
We are here to
ciudadanía.
serve you, we are here
Muchas
to
gracias.
help you, and all of the citizens
Muchas gracias,
and all
Irma
of
Costa Miranda,
Mexicans.
técnica de
Thank you very
atención
much.
y
Thank
orientación
you,
al derechohabiente en el
Irma
Instituto
Costa
Mexicano del
Miranda.
Seguro Social. Vamos a abrir ahora preguntas y
Let's
respuestas.
begin now with the
Bianca
Q&A
Aguirre, Notimex, adelante,
period.
por
Blanca
favor.
Aguirre from
Blanca,
Notimex,
a la vez.
please.
Gracias, buenas noches.
Thank you.
Por favor, pues obviamente esta semana
Obviously,
pues,
this
es
week
muy difícil.
has been very
Viene el
difficult,
pico más alto de
and we are
contagios. Quiero
about
saber,
to
por
reach
favor,
the
doctor,
peak
¿qué va a
regarding,
pasar,
we're about to peak
a nivel nacional,
in
obviamente,
terms of
del
transmission
6
rates
al
and
10 de mayo?
contagion.
Se van a tomar
So what is going to
nuevas medidas,
happen
y es
from
que
May the
hoy no
6th
sé qué
to
pasó,
May
pero
the
al menos en la
10th?
Ciudad de México se
I don't know
vio
what happened
muchísima gente. Ya
today,
lo comentaban
but
en
at
la
least in
conferencia
Mexico
anterior.
City, we saw a lot of people out there,
En los bancos,
a lot of
afuera.
people in banks, outside, in the public space. What is going to happen? Yes, indeed, this is an opportunity for us to remember that the National Safe Distance campaign is a package of different interventions that are aimed at decreasing the contagion and the transmission rates of COVID, which is a disease that is transmitted through respiratory to the respiratory tract, and when we are closely talking to someone else, we could, if one of us is infected, if we project our respiratory secretions that are come out through our nose trails and through our mouth, these secretions, though invisible, they could reach the other person through the eyes, through the nose, through the mouth, and then infect them. Also, we can get infected through our hands by touching infected surfaces and then touching our mouth or our nose or our eyes, and then when we shake someone else's hand, we infect them as well. And this is why this national campaign has three measures, three interventions. It started on March the 23rd, and they're basically to suspend all activities within the public, social, and private sector for companies, for businesses, for also for all sorts of economic institutions that are not essential, and most of them are not essential. This was the first measure. The other one was to suspend all school activities, and then the third one was to stay home and not go out. We have summarized this measure with this very short, emphatic phrase, which is stay at home, stay at home, stay at home. This is a short but powerful recommendation that we should all abide by. Only in the case that you have an indispensable duty that you have to perform, then go out. But otherwise, unless it's very urgent, unless it's an emergency, you shouldn't leave your home. We've been monitoring urban mobility, meaning mobility levels within the public space, people who use public transportation, people who walk on the go from one place to another. We've been monitoring the levels, and these levels have been showing a decrease. But what is exactly what we are trying to avoid? For these mobility levels to go back up, because this would translate into a higher transmission rate in those areas in which mobility is being increased. We are in phase 3 right now. We are experiencing the highest numbers in newly confirmed cases that we have seen so far, and these cases that are appearing right now became infected last week. because remember there is an incubation period, and everyone who is getting infected right now will appear into the statistic next week. So everything that we are doing now will reflect on on the development of the pandemic a week later, at least. During the preparation phase that in Mexico started in January the 15th, we adopted a plan of of expansion the health sector capacity. This meant to retrofit and reorganize physically the hospitals, to add some intensive care units into some of them, reorganize some of the procedures and surgeries that were not urgent, without compromising, of course, the health of, of people, and reach and now that we have reached this level of the pandemic, we have started installing some extra spaces, and that are temporary hospital facilities. And this has been done within the public sector and also in alliance with the private sector. We also signed an agreement with the private sector through the Mexican Foundation for Health for patients that were in principle being treated at IMSS, but also patients that are supposed to be treated in other institutions or that do not have any medical insurance. Through this agreement, they can access medical treatment in private facilities completely free of cost, because this has been reached through an agreement with private hospitals. All of these mechanisms have allowed us to expand the capacity of our overall health system, and in some of the most affected cities, we have a reserve of available beds and available facilities of 30%, and in other cities we have greater availability rates. So what's going to happen during the next weeks? That these patterns will continue to present. In some instances, we might see that some hospitals are reaching over capacity, and what we will do in these scenarios is to transfer a portion of the patients to other hospitals in order to deal with these problems. And we talked about a few days ago in the conference, we talked about how IMSS has also made a temporary reorganization of its protocols so they can provide treatment to patients that are not medically insured and have no medical insurance whatsoever.
There has been quite a bit of mobility. Yes, I wouldn't say that people don't understand. I think it's more we have to say thank you. Thank you to Mexico. Thank you to the people. Thank you for responding to this challenge with discipline and with solidarity. We've said this from the beginning. Mexico is a country that has social and economic conditions that are totally diverse. There's so many people living in poverty. But what happened in the European countries is that they used public influence as a sort of coercion to make people stay at home. And we thought, no, in Mexico, that's not going to work. So the highest transmission that has happened, even with this high transmission, we are not going to militarize. We're not bringing in the military to make people stay at home. We're not going to be using coercion to make people stay at home. The recommendations designed by the government of Mexico were designed very carefully we wanted to look at what are the actions that make people go out from their house, that leave their house. There are many, but there are three main ones: work, school, or recreation. If we prohibit or restrict or suspend by law temporary those activities, we're going to have huge demobilization of people in public. We've had about 68% of people at the national level in different states who have reduced significantly mobility in public. What is ideal is for this not to happen, but we must appeal to you again. Please visualize yourself not going outside of your home because you will be more protected. People who are 60 or older, pregnant women, and people who have chronic diseases such as high blood pressure, obesity, diabetes, chronic lung problems, cancer, HIV, or they have immunosuppression, these people are at the highest risk from complications of getting COVID. Besides this, we must appeal again, and we are going to be doing it every single day. This disease can be surprising in how fast it evolves. So perhaps today, someone in the morning has symptoms. They have a fever, they have a cough, their throat hurts, their body feels stiff. Maybe they have a runny nose, maybe their eyes are red. These are the most common symptoms of COVID. And so perhaps this starts lightly with just a couple of symptoms without any other problems. And then perhaps in a couple of hours, some people start to have difficulty breathing, or they start to feel very tired, or they become very pale, or their skin is dark. This is because they aren't getting enough oxygen. What might the reason be? Severe lung damage in both lungs, and the infection has extended and it's causing damage in the lungs because of inflammation. They're stopping the lungs from doing their main function, which is to oxygenate blood, and this makes people not able to breathe. So when this happens and this continues for a couple of hours, medically we call this respiratory fatigue. Respiratory fatigue is when someone, without even knowing it, they're breathing more intensely and faster at a faster rate. And then they get to a place, they get to a point where their body can't take it and they need a ventilator. We call that a ventilator. They're going to need that, and we don't want that to happen. That's why we have been saying this disease can surprise you. Please don't take it lightly. This can be very serious, very severe, or even lethal. Thank you, Bianca, for your question. Blanca Valadez, you, and then you. Good afternoon, Deputy Secretary. Yesterday, you said that between May 3rd and 15th, this could be, there could result in approximately 1,800 intubated patients, and in the worst case scenario, 2,800. Do we have those ventilators? Do we have enough ventilators to deal with that model that you were saying that could come to pass? Or are we going to have another spike and not enough ventilators? And then there was another interview that you did with a foreigner, and you were saying that there could be up to 8,000 deaths from this pandemic. I don't know if that's exact, or if you could tell us exactly how many deaths, what number approximately. And then also if you could tell us about positivity. We're in 5.4% right now out of 10 people. So that means 5 out of 10 people would be infected with COVID. Is that true? Oh, thank you very much, Blanca.
Gracias, Blanca.
Now,
Otra
about your
pregunta.
last question, that
Sobre la última,
5.4,
este
that's for every
5.4 es por
100,000
100,000
inhabitants. For
habitantes.
every
O sea, de cada
100,000,
100,000,
5.4 have
5.4
COVID right now.
tienen COVID
And
en
that
este
number has
momento.
been
Y esta
changing,
cifra ha ido cambiando
especially with
precisamente
the
conforme
increase in
aumente
the
el
daily
número
number
diario
of
de casos, lo que
cases.
de
If
manera
we
simple le
see that
llamamos el
curve
aumento de la curva
going
o el
up,
ascenso de la curva,
then we can see that it's
vemos que
growing
ha
and there will
ido
be
creciendo.
more.
En
But
este
right
momento,
now,
al corte de
just
ayer,
from
o de
today,
hoy en la
we
tarde
have
más bien, tenemos
5.4 people
5.4
out of every
personas por cada
100,000 in
100,000
Mexico
que
who have
habitan en
COVID
México
in the
tienen
last
COVID
14
en los
days.
últimos 14 días.
Now, about the
Sobre la
lethality, the
estimación de mortalidad,
lethality
sí, sigue
index,
siendo la que hemos
as you can
proyectado.
see right now,
Ahorita,
we
como
have
pudieron ver, tenemos 2,000,
2,000,
eh,
thank you,
gracias,
2,271 people who have
2,271
lost their lives
personas que han
because
perdido
of
la vida
COVID.
por
And
COVID
we are
y
right
estamos
at
justo en
the
el punto,
medium,
cerca
we're
del
right in
punto
the
medio de la
middle
curva
of
epidémica.
the
En
pandemic
el
curve. When we
descenso de la
see it
curva
starting to go
podemos
down,
tener las
then we could have
otras
another
más o
two or
menos
3,000
2,000 o
people.
3,000
And with
y con
that,
ello
that
ya
would be
tendríamos
6,000
casi
people,
6,000
or maybe
o un poquito
5,721
5,731 si lo
if we
ponemos nada
just
más
add
así,
3,000 more.
simplemente agregar
The
3,000 más.
projection,
La
I think
proyección
we see
consideró
this
una
pandemic
oleada
wave
epidémica
that could be
más
more
extensa
extensive in
en
different
distintas
cities.
ciudades.
In
Y
1
en
week,
lo de la
we have
última
shared
semana
this
hemos
positive
compartido esta
news,
noticia positiva de
not
que
just from
no solo
direct
por observación
observation that
directa,
we've
como
been
lo hemos venido
documenting every single
documentando
day,
todos los
but
días,
because of
sino también por las
mathematical
proyecciones
projections,
matemáticas,
we
se
think
aprecia
some
que algunas
cities
ciudades
are
ya están
on the
en la
decline. For
parte de
example,
declive.
Cancun. A
Cancún,
few
por
days ago,
ejemplo,
we
que
announced
hace
that it
unos
was in the
días
middle
anunciamos
of
que
the
estaba en el
pandemic curve,
punto
and it
medio, en
seems that
este
it
momento
is in a
parece estar
tendency
ya
that
en
is
una
going downward.
tendencia hacia
Now,
abajo.
very important,
Ahora,
this
muy
does not
importante,
mean
esto
that
no
you
quiere
can
decir
stop
que ya
the
se pueden suspender las
Susanna
medidas de sana
safe
distancia.
distance measures.
Si lo
If you
hiciéramos en
do
este
that, we're
momento,
in grave
tendríamos el grave
danger of that the
peligro
pandemic
de que
is going
reemerja
to
la
come
epidemia,
up again. It's going
de
to
que
rear its
reemerja la
ugly head.
epidemia. En la medida en que
We
todavía
have
existen personas
infected people,
infectadas,
and
personas
these
con
people can
enfermedad, estas
transmit to
pueden
more
transmitir
people.
a
They
otras
can create
personas,
more
causar
contagion,
contagio
and within
y
7
en un promedio de
days,
7
we
días
could
después
have another
manifestarse como
reemergence,
una
a local
reemergencia
reemergence of the pandemic.
local de la
Your
epidemia.
first question,
¿Sí?
what was it?
Y su
The
primera pregunta,
ventilators.
ventiladores.
Thank you. Yes.
Muchas
From the
gracias.
projections
Efectivamente,
or the
de las predicciones o
mathematical
proyecciones matemáticas,
projections,
tenemos
we
que en el
think that the
punto
middle
medio
of the
de la epidemia,
pandemic,
que
we
se ha
have
estimado
estimated
que
that
podría
could
ocurrir
occur,
el 6,
could occur
la
on May
ocurrencia de
6th,
casos el 6 de mayo,
and then
y
15 days
15 días
later,
después
after the
del punto
highest
máximo
number of
de
people
personas hospitalizadas en
hospitalized
terapia
in intensive
intensiva,
care, we think
hemos
that we
considerado
would have
que llegaríamos a
1,800
tener
people after that
1,800 personas hospitalizadas en
hospitalized
terapia
in
intensiva.
intensive
¿Cuál
care.
es la
What is
explicación
the
de esta diferencia de
explanation for the
fechas?
cases
Que
that
los
occur
casos ocurren
today
hoy,
and these
tienen un
numbers?
periodo de
Well, they
enfermedad,
get sick
luego
today,
pueden
they get
agravarse,
worse, then they're
se
hospitalized,
hospitalizan y ya
then on
hospitalizadas
average they're in
pueden durar en
hospital for
promedio
10
10 días
days.
en
And then what is the
hospitalización. Por eso el
maximum
punto
point of
máximo de
new
contagios o de
cases every
casos
day?
nuevos
Well,
diarios
probably
está
between 12
en
or
promedio de
13
unos 12
days
o 13 días
after the
detrás del
maximum
punto de
occupancy
máxima
rate
ocupación
in
de
the
las
intensive
terapias
care unit.
intensivas. Ahora, esta es la
But
predicción media,
as you have
pero
pointed
como
out, we
usted bien
do have an
señala,
interval
tenemos un intervalo donde
where
tenemos
we
una
do see
situación
that
de
probability
una
that we would have
probabilidad de estimación
90%,
del 90%
and that would
que nos
make us
llevaría a considerar
think about
escenarios menos probables
less
y
probable
un número mayor de
cases,
casos,
maybe
cerca
1,000
de
more.
2,800, o sea, 1,000 más.
We have seen
Nosotros
from
hemos
the
considerado
beginning,
desde
we've
el
looked at the
inicio
most challenging
los escenarios
scenarios, the
más
most
retadores,
difficult
más
ones.
difíciles.
And
Y
that's why
entonces
we
se
have
ha hecho
reorganized our
esta reorganización
hospitals.
de los hospitales
And in
y en
terms
el caso
of
concreto de los ventiladores,
ventilators, we
distintas
have bought
intervenciones.
more
Compra de
ventilators.
nuevos
We have
equipos,
also
hemos
repaired
tenido
them,
también
and this is
reparación.
impressive.
Esto es
In
impresionante.
Mexico, we
En
have
México
documented,
teníamos
or more
documentados,
concretely, they were
o
not
más concretamente
documented,
no
we
estaban
documented
documentados,
them,
los
more than
documentamos, más de
1,800 ventilators
1,800
that
ventiladores
were not
mecánicos
being used
que estaban en
at different
desuso
hospitals
en los
all over the
distintos
country
hospitales
because they
del
hadn't been
país
repaired.
porque no se habían
So it
reparado.
turns out
Y
that more than
resultó que más del
67% of those were repairable.
67% de ellos eran reparables.
So we did need to change a little light,
Había
a
que
little
cambiarles un
lever, a
poquito,
little
una
button, a
palanquita,
little
un
transistor, a little
botón, un
piece.
transistor, una
So
pieza.
with the
Y
support
entonces,
of the
con el apoyo de la
Navy,
Secretaría de
they
Marina, que
really
tiene
have a
una
solid
muy
unit for
sólida unidad de
biomedical
ingeniería biomédica,
ventilators. We put out contracts for 2 ventilator manufacturers, and we also asked them to help us repair the ventilators that we already have. So now we have more than 280. Tomorrow, we're going to let you know how far we've advanced with all of this. Now, a third thing that has been very important is how we have reorganized where ventilators are being used. And we've done this with by leaning hard on solidarity between hospitals, among hospitals. Dr. Gustavo Reyans, who is the head of that hospital, he said he would need 170 ventilators at his hospital and in federal hospitals so that he would be able to do another organization cycle of hospitals. Now, the Mexican Institute of Social Security, in a beautiful solidarity act that definitely characterizes them, they said that they would lend those ventilators to help out with that reorganization. The good news is that the pandemic presents itself in different areas, different patches. So we'll be able to redistribute the ventilators that we have, mainly in Mexico's social security institutions, to take them from places where they don't need them and have a prediction about when they think they might need them. And when they don't, we'll say we're going to use them here in this city, in that city, which city needs them, with a little bit of anticipation so that we'll be able to send those to where they're needed. That's basically the organizational framework that we're using. Yes, definitely. Yes, this has been a multiple effort. And we've been working with our colleagues throughout the whole health sector and with people outside of the health sector, including Mr. Ebrard, who has been helping us with the acquisition of these ventilators. We also have something that we've been working on that from the United States is this plan to facilitate, and this is by the chancellor who's been helping with this, and he's been helping us facilitate calls with people in the United States. Yeah, we were thinking about 1,000. Juan Ferrer, we'll have to talk to him and ask him what is the exact number of ventilators that have been transferred from the United States. Yes, you too, and then if we have time, you. Good evening, Liz Varo Alvarez from Grupo Canton. My question is for you, Leila Costa. Could you give us some more information, the telephone numbers, the ones that you gave us? From what time to what time can people call these places where you physically are? At what time can people go there? And then also, what are you referring to? People who are worried about sick family members and want to know what is going on with their sick family members. So maybe without wanting to, they get a silly answer or poor answer. And so I would really like you to dive deeper into that information. Yes, with great pleasure. You can call from 8 a.m. to 8 p.m. from Monday to Friday. And on the weekends, it's 8 a.m. to 2 p.m. By email, 24 hours a day. We also have our personnel who will be there to give you that information. You can also find us in person at our hospital units 24 hours a day. We have a morning shift, night shift, and we are there at the COVID-19 hospitals all the time. Our personnel is there 24 hours a day to answer users' questions. This is how we've always worked. This is not because of COVID, the pandemic. We have our protocols for good treatment. Our area is known for being that link between the operative side of the hospital and hospital users or members of IMSS. We try to our very best to be able to answer all of your questions. And now with this health emergency, speaking of all the actions that we've been taking, we've been trying to support you the best we can. At the COVID hospitals, we have personnel there 24 hours a day. And constantly, our fair treatment protocol means that you have different options depending on how you come to us. Some people come to us and they're very worried, and sometimes they're violent or angry, or sometimes they're calm. So, depending on how someone comes, how they approach us, that's how we try to figure out how to help them and keep them calm, know that they can trust us, so that they can know that we have all that information there to give them.
Con respecto,
Yes,
ayer
you.
la secretaria de Economía nos explicaba algunos planes de la
With
estrategia para el
regard
regreso. ¿Qué va a
to
ser en
what the
distintas
Minister
fases?
of the
Nos quedó
Economy said
algo en especial
yesterday,
en 3 puntos.
that there are going to be different
El
phases. Could
tratamiento
you
que la
talk
FDA ya
to us
aprobó
about
para
3
uso de
specific
emergencia.
points?
También
Treatment
respecto a
from the
las vacunas, si
FDA
estamos
that
involucrados en
they
los
have
proyectos como Light
approved for
Speed para
emergency
acelerar el
use,
producimiento de las
and
vacunas
then
y
also
cuál sería su postura con
vaccination. Are we
respecto al
involved in
polémico
programs
tema de
like
las pruebas.
Lightspeed?
Con mucho
And what
gusto.
is your
Sobre
stance
vacunas,
in terms
primero,
of this polemical
no soy
theme
tan
subject
optimista
of
de que tengamos una
tests?
vacuna
About
pronto. Efectivamente,
vaccinations, first, I'm
hay
really not
algunas
very
iniciativas en el
optimistic about
mundo
us having one
de
soon.
investigación para el
There
potencial desarrollo de
are
vacunas,
initiatives in the
pero
world of for research for
nunca se ha
developing a
visto que una
vaccination,
vacuna se logre tener en un
but
periodo
we have never
sumamente
seen
rápido,
a
podríamos hablar de 4 o
vaccination
5 años. Hoy se ha
in
hablado
such a
sobre distintos
fast
mecanismos de facilitación que
time.
hay
Usually it's
entre
4 or 5
gobiernos con
years.
ayuda de, por
We've
ejemplo, de la
talked
Organización
about the
Mundial de la Salud.
different
Se podría reducir este
facilitation
tiempo
measures
quizá a
that we
2
have
años o
between
3.
governments, for
Pero
example,
entonces
the WHO,
difícilmente tendríamos la vacuna
and
durante
they're
el
saying
periodo
maybe
relevante
2
de
or
este
3
primer
years.
ciclo
So it would
epidémico.
be very
Deseo que sí
difficult
ocurra,
to have a
por supuesto,
vaccination
pero siendo
during
realistas
this
hay que
first
considerar esto.
pandemic cycle. I'm not saying it's not going to happen,
Sobre la
but let's
primera
be
pregunta fue
realistic. Your first
eso es. FDA
question.
son las siglas en inglés
Ah,
de la
FDA.
Agencia de Fármacos y Alimentos,
Yes,
que es la agencia
FDA,
regulatoria, aquí para
the
referencia de la
Food
ciudadanía
and Drug
mexicana, es la
Administration.
equivalente a COFEPRIS en
For
México.
reference
COFEPRIS es la
to
Comisión
Mexicans who
Federal
are
para la
listening to that,
Protección
this is
contra
about
Riesgos
equal to
Sanitarios. Es la
COFEPRIS in
agencia
Mexico,
gubernamental que se encarga de
which
regular
is to protect
precisamente
you against
la
sanitary
autorización
risks.
de el
This
uso
is
de
a
nuevos fármacos en un
government
territorio, en el caso
organization
que
that
se relata de la
regulates
FDA
the use of
es en
new
Estados Unidos.
drugs
La
in a
FDA,
certain
al igual
area.
que
For
COFEPRIS,
example,
al
in
igual
the
que muchas
FDA is for the
agencias de
United
regulación
States.
sanitaria
The
del mundo,
FDA, the same as
tienen un
COFEPRIS and the
elemento
same as many
específico, vamos a
other
llamarlo un
health
protocolo, para
regulatory
considerar
agencies in the world,
autorizaciones de
they
emergencia
have a
de nuevos
protocol
productos que pudieran ser
so that they can
prometedores
consider
para los tratamientos. Esto no quiere
emergency
decir, porque hay
products
una particularidad, que se
that can be
aprueban
affirmed
para
to
un
be
uso
used
generalizado
during
fuera
an
de la condición de
emergency, that
emergencia.
they can be
Se
approved.
establecen los elementos
So,
técnicos y
since it's an
legales muy
emergency, they
explícitos
can be
de
approved in a
que es
faster way
solamente
than they
en los
would
casos de
before
emergencia.
because there are
En
very
este
specific
momento ha
technical and
habido
legal
cerca de 6
guidelines
o
for
7
approving
medicamentos
medication.
que se han
Right now, there
considerado como
have been about
candidatos a
6 or 7
tratamiento.
different
Se ha mencionado aquí
medications
la
that have
hidroxicloroquina, la
been earmarked
cloroquina,
as
la acitromicina,
candidates.
que son
For
productos ya
example,
antiguos que se usaban para
hydrocloxichloroquine,
otras cosas.
cloxichloroquine, acetylene.
Hay también un
Those were
modulador de la
used
inmunidad
for other
y
things,
también,
but
posiblemente al que usted se
people
está
are
refiriendo,
watching them
es
closely to see if we
un
can use them
antiviral que se llama
for
Remdesivir,
dealing with
y este
treating
antiviral
coronavirus. We also
recientemente,
have
me
an
parece que fue el viernes,
antiviral called
la FDA
Remdesivir.
consideró que
And
podría
recently, I think on
autorizarlo
Friday,
y
the
no
FDA
aprobarlo,
thought
hay una pequeña
perhaps they could
distinción en ello,
authorize that,
para
not
su uso
approve
durante
it. There's a
la
small
emergencia
difference
en
there.
una condición
So
que
that
se llama
recidivir
de
could be
uso
used
novedoso
during this
compasivo,
emergency
podríamos llamarlo.
situation.
Ahora, ¿qué quiere
That
decir
would
esto?
be
Que
called
todavía
a
la evidencia
passive
científica
novel
sobre
use
su
of this
utilidad
medication.
no es
The
concluyente.
scientific
Y
evidence
eso,
about
en un momento dado,
the
es importante
utility of this is
considerarlo
not
porque
conclusive.
no debemos pasar
So it's
de la
important to
evidencia
remember
científica
we
inicial
can't
al uso generalizado.
we
Porque falta
can't jump
mucho por
over
entender si
scientific evidence
funciona,
and go to general
si es
use
seguro
because there's so
y si en un
much to
momento
still
dado ese
understand about whether it
funcionamiento
works or not,
aplicado a
if it's
condiciones
safe,
reales, que son por
and
ejemplo la diversidad de
if
las
using that
presentaciones
under
clínicas de
real
los pacientes,
conditions, for
pudieran llevar
example,
a
in a diversity of
efectividad, es decir,
presentations for
una
clinical patients,
capacidad de
if it
beneficiar
could be
en condiciones
effective.
reales. Esa es la
That is to
situación que
say,
hay
if it
con
would
estos
be
productos.
capable
Y
of
pruebas,
benefiting people under real situations.
básicamente, podemos
That's what's
hacer una
going on
buena
with those
sesión sobre
products,
pruebas.
those
En el
medications.
estado del arte, la situación actual
Now, we
se
could
resume de
do a
la
whole
siguiente
other
manera.
session
Tenemos dos grandes
about
grupos de pruebas
tests, but
posibles
let me sum
para
it up for
pedir
you. we have two large groups of tests possible for COVID. The first are tests that we call molecular tests that detect through different technological mechanisms the biological part of the virus. In that way, you can identify the presence of the virus in secretions, in liquids, for example, from your nose and throat. These tests, they're specifically aimed at the acute point of the pandemic. So if someone suspects that they have COVID, that person probably does have COVID right now. There are another group of tests, those are serological tests, and that's where we use a specimen not from our respiratory tracts, we use it from our blood. We take a sample of the blood and then we use that to detect antibodies against the virus. Those antibodies are the immune system's response or part of the defenses from the human body to the virus, to the infection. How useful are these tests? Well, it's, yes, useful to document the history of infection in a person who very probably, at the point that they have antibodies, they've gotten over the virus. But at that moment, we would be able to recognize how many people in our population or what percentage of our population could have had the infection and developed antibodies. And if those antibodies protect them, then they would know that they're protected. That's basically the tests situation. Very quick question. It's 7:56. Hello, I'm from, yes, you next. Okay, now about this stepped going back to school. What happens if we have a resurgence of contagion? What measures would you be taking because of that? And would that be aimed at the Ministry of Health? Or would it be an independent decision on behalf of each state? Thank you, Pablo. Very important questions. In the change between in the change of a pandemic going up slowly, we go from phase 1, phase 2, phase 3, and you could think that perhaps then we would have phase 2 and phase 1 on the back other side. Now, in a certain way, it does behave that way with some characteristics. We could lower the speed of cases per day, and that could be useful to reactivate our sentinel surveillance. Now, when we're in the final phase, it could be useful to use the contention tools that we had originally been using to stay at home. So there is a sort of symmetry there between the up and the down. But when we look about it, when we look at the whole country, we see that there are different scenarios because at the beginning of the curve, in our first scenario, we didn't have a circulation. The virus wasn't circulating in Mexico. Now that we're on the way out, because for example, with the 5 cities with active transmission, including Mexico City, at the outgoing point, we're still going to have other cities that are still in higher points of transmission. And we don't want reemergence. So it's every place all over the Republic is going to be different. It's not going to be the same. And the Federal Ministry of Health, which is the health authority at a national level, they're working also with the state governments who are also their own health authorities. So what we do is make a general agreement, and then the health law clearly dictates what each state should be doing, the national or what each health authority should be doing, national health authorities and state authorities. What measures could we implement? Well, in states, territories, areas, even segments of those areas who are starting in their upward trend, they might be having the same types of measures that we put into place at the beginning. But I really like your question because there's an important difference here. The most probable, God willing, that we do not need any general actions to be taken, God willing. Because if this pandemic starts up with the intensity like it did have at the beginning, then we will need general measures. But we really need to focus on the areas that have high transmission and see which areas have high transmission, which have low transmission. And that's what we were hearing from the national health authorities a couple of weeks ago as well. And they are working with technical people with CONACYT. And it's very interesting to see the information that they're going to be using to see the connectivity between communities so that we can temporarily that connectivity to avoid transmission from a high propagation area to a lower propagation area. Thank you so much, Pablo. I think we're there. It's 3 o'clock on the dot. Thank you so much for paying attention. Thank you.